Good morning. Greetings from the Boyne Valley in County Meath, Ireland. I am Prof Stanton and I'm delighted to be joining this symposium concerning sustainable diets, the complicated truth. The title of my talk is Animal Source Foods and Human Health, the Evidence. Here are my disclosures. I'm going to start by reminding you of the World Health Organization's definition of a healthy diet. A healthy diet helps to protect against malnutrition in all its forms, as well as non-communicable diseases such as diabetes, heart disease, strokes, and cancer. And we're not doing very well concerning a healthy diet worldwide. We know that almost 1 billion are chronically undernourished. This is where women, children, and men go to bed hungry because of insufficient calories. But almost 2 billion of us are overweight or obese. And what's less well recognized is there's another 2 billion who suffer from hidden hunger. Their diets are inadequate qualitatively, either due to insufficient protein or quality amino acids or vitamins or essential minerals. Many of those essential micronutrients actually are best sourced from animal source foods. This is summarized by the Global Burden of Disease analysis from 2017. And you can see here that dietary risks were responsible for 22 million deaths and almost 1 billion DALYs. DALYs are disability adjusted life years. And disability adjusted life years actually are a better measure of the misery that occurs due to illnesses. So they account for the misery, but they also actually are a really good measure of the economic costs of illness. The amount of hospital care and community care that needs to be provided for people who don't die of their illnesses, but suffer from illness. The loss of earnings of people in their middle years. And you can see here that actually some of the deaths and DALYs occur due to dietary excesses, and shown to the top of the two panels, but even more die or suffer from illness due to deficiencies. We're going to talk about the nutrient deficiencies a little bit more. Animal source foods actually contain unique nutrients, such as high biological value protein, because they have a complete amino acid profile, which is bioavailable to humans. Animal source foods are the only dietary sources of a number of nutrients: retinol, heme iron, vitamin B12, and the most bioactive vitamin D. They are the source of highly bioavailable zinc, iodine, and selenium, as you know. And oily fish is the major source of long-chain omega-3 polyunsaturated fatty acids, DHA and EPA. They also contain unique bioactive compounds such as CLA and bioactive peptides. And we now know that grass-fed meat and milk contain meaningful amounts of phytonutrients, which are usually only found in plant source foods. Phytonutrients such as terpenoids, phenols, carotenoids, and antioxidants. The most commonly lacking nutrients are iron, zinc, vitamin A, calcium, folate, and vitamin B12. And you can see from this table that actually it's animal source foods that dominate the top of the table and are rich in at least two of these critical nutrients. So only dark leafy green occupies the top 10, or a position in the top 10 of the table. All of the rest are animal source foods. Another way of looking at it is, if 1/3 of calories come from animal source foods, you are very unlikely to be deficient in these vitamins or in these essential minerals. However, if the diet is composed of less than 1/3 or less than 30% of animal source foods, increasing deficiencies of vitamins and of minerals occur. There now are a wealth of publications that demonstrate that animal source foods influence favourably child growth and development. The more animal source foods you have, the taller children are, the less likely they are to suffer from stunting. Head circumferences are increased, cognitive function is improved. Going back to the global burden of disease slide, you can see here that child and maternal malnutrition are leading causes of disease burden in the 21st century. And in fact, there's a disproportionate effect on DALYs, on illnesses that don't kill, because much of child malnutrition doesn't necessarily cause death, but it causes prolonged suffering or loss of quality of life throughout the lifespan of that child that received inadequate nutrition in the first 1,000 days of life. One of the most adverse outcomes of child and maternal malnutrition is childhood stunting. And childhood stunting is not just smaller children, it's also physically impaired and cognitively impaired children, which has knock-on implications for the whole of the lifespan of that child. Reduced achievement during school life, lesser career opportunities, and therefore lesser earning capacity in order to provide for their family in the future, and therefore a vicious circle is produced. This is the distribution of childhood stunting throughout the world in the lower left panel. And you can see that those countries that are coloured in pink actually have at least 30% prevalence of childhood stunting. So 1 in 3 children is stunted. This is a terrible consequence of child and maternal malnutrition. This level of childhood stunting occurs in sub-Saharan Africa and in southern Asia. And you can see that actually these are the exact same countries that have the least intake of milk and the least intake of meat per person per year. This is an association that is demonstrated here, but we have the gold standard of interventional studies performed in Kenya and published about 6 years ago. This is where 12 schools were selected in Kenya for an interventional study. And the 12 schools were randomized to 4 different feeding regimes. The first group were provided with a plain githeri or vegetable stew on a daily basis when they attended school. The second group got the vegetable stew with the addition of milk. The third group got the vegetable stew with included meat, and the final group got no additional food. These children were studied for 5 semesters, almost 2 years, and they were tested in 7 different subjects, so arithmetic, English, 2 national languages, geography, science, and the arts. And their scores, the difference between the baseline score and the score at the end of the 5 semesters are illustrated in this table. And then there's a summary of the total scores. Those that got meat and vegetable scored best. Next was the milk and vegetable group. In actual fact, those that got vegetables alone, their scores actually deteriorated, and those that got no additional feeding deteriorated further. This is about a 20% difference in scores between the top meat group and the control group. That's a huge difference after 2 years of schooling. A clear benefit for academic achievement amongst those children that were fed both meat and vegetables. It's not only the young that benefit from animal source foods. This is a publication just this year which showed that the more animal protein intake that was enjoyed by the participants, the more likely were they to survive. Similarly, another publication this year showed that total meat intake is associated with life expectancy. They looked at both childhood mortality and life expectancy at birth and life expectancy from 5 years of age. For child mortality under the age of 5, there was an inverse relationship between meat consumption, kilograms per person per year, and life expectancy and mortality. Whereas the more meat that was consumed, the more likely were people to survive into a long lifespan. Coming back to the impact of dietary risk factors on chronic diseases such as cardiovascular disease and cancers, you can see here that diets high in red meat only account for less than 0.1% of all dietary risks related deaths and DALYs, a tiny proportion here. Looking a little bit closer at red meat consumption and its relationship with colorectal cancer. In the left-hand panel, we're looking at the distribution of red meat consumption worldwide. And you can see that most people are eating less than 75 grams a day on average. That will be equivalent to about 4 portions of red meat per week. It's a trimodal distribution, so people from high income countries eat more meat, perhaps an average of 50 grams per day. Those of intermediate income eat less, and those countries with low income, in fact, eat very little red meat, perhaps 10 to 15 grams a day, less than 1 portion per week. Looking at the relationship in the right-hand panel between red meat consumption and risk of colorectal cancer, you can see that at 50 grams of red meat, there actually isn't any increase, certainly not any statistically significant or relevant increase in risk of colorectal cancer. Only when you get to levels of red meat consumption, such as 110 grams of red meat per day, which would be at least 1 portion of red meat per day at least, do you arrive at a statistically significant 5% increase in the risk of colorectal cancer. But actually, virtually no one is eating 110 grams of red meat per day. Diets that are low in milk actually cause deaths and illness. And this is actually an underestimate, because this only includes the relationship between diet and colorectal cancer. Again, let's look at the distribution of milk consumption across the world. The majority of the world are consuming less than 300 grams per day of milk. That's less than one portion per day. And many people are consuming less than one portion per week indeed. However, the relationship between dairy products and colorectal cancer shows that you get increased protection from colorectal cancer with increasing amounts of dairy products, right up to 850 grams per day, which very few people are doing. The global burden of disease in 2017 did not consider the protection afforded by dairy from cardiovascular events, from heart attacks and strokes. This was clearly shown in the PURE study, the Prospective Urban Rural Epidemiology study, which was published in The Lancet in 2018. And what they did was they looked at habits of eating dairy, milk, cheese, yogurt and butter. And they compared those that were eating very little dairy with those that were eating at least 2 servings of dairy per day. And they found that eating at least 2 servings per day of full-fat dairy provided a 25% reduction or protection against death, and a 32% protection against major cardiovascular disease. That includes heart attacks and strokes. This study was confirmed by a further publication in 2021, where they looked at, in a group of Scandinavian adults, what was the relationship between blood levels of a biomarker of dairy fat intake, pentadecanoic acid, and cardiovascular events. And they found that the higher the level of pentadecanoic acid, the less likely were you to suffer from a cardiovascular event. So a 60% reduction at the highest level of this biomarker of dairy fat intake. Turning to some aspects of our current diet that actually does cause problems for chronic disease, ends up causing heart attacks and strokes in big numbers. And they are excessive calorie intake or obesity and diets that are very high in salt. They're the leading cause of deaths and DALYs in the 21st century. And a key cause of diets high in calories and diets high in salt are ultra-processed foods. So let's look at the association between ultra-processed foods and obesity. Now, ultra-processed foods are industrially manufactured, ready to eat, ready to heat formulations. They're made mostly from substances that are derived from foods, and they have very little whole foods. They're very high in added sugars and salt, and also multiple additives, flavorings, coloring agents, emulsifiers, and preservatives. Those that eat the least ultra-processed foods are the least likely to suffer from obesity. And those that more than 75% of their diet was composed of ultra-processed foods were the most likely to suffer from obesity. So consumers of the most ultra-processed foods were 53% more likely to exhibit obesity than consumers of the least ultra-processed food. Now, note, the least ultra-processed food consumers were still 1/3 of their diet was ultra-processed foods. And we really wouldn't recommend that. We'd recommend much less than that being ultra-processed foods. Now, this was an association study, but again, we've got a randomized controlled study that actually proves that this is truly a causative relationship. So what Hall and colleagues did was they admitted a group of people to their metabolic ward. And for 2 weeks, they ate a mainly ultra-processed diet. They had free access to whatever they wanted to eat of an ultra-processed diet, as much as they wanted. For 2 weeks, they ate a non-processed diet. Again, they had free access to a wide range of unprocessed whole foods, and they could eat as much as they liked. The diets were presented in random order, and they were matched for what was offered in terms of calories, sugar, fat, fiber, and macronutrients. Looking at the calorific intake, those on the ultra-processed diet, or while they were on the ultra-processed diet, they ate 500 calories per day more than those that were eating the unprocessed diet. So 3,000 calories a day by comparison with 2,500 calories per day. While eating the ultra-processed diet, weight increased by 1 kilogram. The 2 weeks of eating the unprocessed diet, weight fell by 1 kilogram. So a difference of 2 kilograms over 2 weeks. Just consider what that would result in if the diet was continued for months and years. Now, the difference wouldn't continue to expand, but there certainly would be up to a 10 kilogram difference in body weight if this was continued long term. Now, what are the plant-based meat and dairy alternatives? Those that are currently available are mainly ultra-processed foods that are high in sugars, salt, and multiple cosmetic additives. So the Beyond Meat burger actually has the same protein content, but it has 5 times the salt that steak does. This is a barbecued jackfruit product, and these are mushroom sausages. Such products typically have even more sugar and salt and have very little protein, multiple additives again. Unsweetened almond milk has only 1/8 the protein of a standard milk, 1/4 the zinc, but twice the sodium or salt. These ultra-processed foods made up with isolated plant proteins, fats, minerals, and vitamins, they very likely underestimate the true nutritional complexities of whole foods in their natural state. And this is what led Professor Van Vliet and colleagues from Duke University to conclude that novel plant-based meat and dairy alternatives should arguably be treated as alternatives in terms of sensory experience, but they shouldn't be treated as true replacements in terms of nutrition. So absolutely fine to take some of these plant-based alternatives once a week, but you really won't get your nutritional requirements from these alone. We are faced with a major challenge with the rise in the world's population. This has risen hugely in the last 100 years and is set to increase from its current value of 7.5 billion to at least 10 billion by 2050. At the same time, we are facing a climate change crisis and also a biodiversity crisis. I am totally in agreement with the solution that was proposed by the UN Global Panel on Agriculture and Food Systems for Nutrition 2020. What they've said is more nutrient-rich whole foods rather than ultra-processed or processed foods, both plant and animal sourced, must be produced through sustainable, resilient food systems. We need to make these nutrient-rich foods available, accessible, affordable, and desirable for all. I'm not as convinced by the solution that was proposed by the Eat Lancet Commission reference diet. This was published in the Lancet in January 2019. What they suggest is that we should move from a plate such as the Eat Well Guide of the UK with 1/3 fruit and vegetables to a double that, so 2/3 fruit and vegetables, a halving of meat and dairy intakes, and a 90% reduction in red meat consumption. Now, I'm not sure that we will convince people to move from 1/3 fruit and vegetables to 2/3. I currently have difficulty in persuading many of my patients to actually eat 5 portions of fruit and vegetables. I totally agree with at least 5 portions of fruit and vegetables per day, but not many of my patients are willing to achieve that currently. I'm also very concerned that while they do say that 11 million deaths will be saved through adoption of this reference diet, they would actually come from the improvement in fruit and vegetables, whole grains and nuts intake, and the reductions in calories and salt intake, not from a reduction in red meat intake, because red meat intake, by their calculations, was only causing 25,000 deaths annually worldwide. There was no accounting of the fact that halving of dairy intake would increase cancer and cardiovascular deaths. Furthermore, there was complete omission of consideration of the nutritional deficiencies that will be caused by halving of meat and dairy intakes. I'm also concerned by 2 relatively recent publications from 2020. This was the updated global burden of disease analysis concerning 2019 versus 2017. And this report from the Lancet Countdown on Health and Climate Change. Both of these publications estimated that red meat is causing almost 900,000 deaths worldwide annually. A huge increase, a 36-fold increase on the previous estimates of 25,000. Let's look a little bit more closely at the 2019 global burden of disease analysis versus the 2017 analysis. And that's illustrated by this figure here. Again, we've got excesses and deficiencies. I've only looked at deaths, but in actual fact, there's a parallel or very similar effect on DALYs, so illnesses that don't cause death. The 2017 analysis is indicated by the black stippled bars. The 2019 analysis or estimates are shown by the yellow bars if they're relatively unchanged. By green bars if deaths reduced in the 2019 analysis, and by red bars if deaths increased in the 2019 analysis by comparison with the 2017 analysis. To the extreme right are the 2019 to 2017 ratio of deaths, again using the same colour coding. Concerning diets low in milk, despite those two publications concerning dairy clearly showing benefits for dairy against heart attacks and strokes, the protections provided by milk and dairy remain underestimated in the 2019 analysis. Many risk factors now appear to be causing less deaths than the 2017 analysis. So diets low in whole grains, fruit and vegetables, nuts and seeds, seafood, omega-3 polyunsaturated fatty acids, all polyunsaturated fatty acids, vitamin A and zinc, and diets high in salt have all substantially declined in their effects. I am concerned about the downgrading of the risks of diets excessive in salt. The evidence is absolutely convincing for salt having a large impact on cancers in addition to cardiovascular events. But what I'm most concerned about are the increases in deaths that are calculated in the 2019 analysis. So diets high in trans fats, in processed meats, in red meat are all judged to be having even greater impact on deaths. Diets low in legumes. The biggest change is deaths attributed to red meat consumption have increased 36-fold. Let's have a look at that a little bit more closely. So how did this 36-fold difference in deaths attributable to red meat consumption arise? The Global Burden of Disease 2019 collaborators do identify three major differences in how they estimated deaths attributable to dietary risk factors in their analysis. And I've highlighted the changes that are particular to red meat in red font. So they've changed the way in which they're estimating dietary intake. And in fact, that may well be more accurate. It does have a net result in that estimated red meat consumption worldwide increased by 20%. So people in high income countries were estimated to be eating about 40 grams of red meat per day. They're now estimated to be eating 50 grams of red meat per day. The 2019 analysis undertook new systematic reviews and meta-regressions. Previously, they had used peer-reviewed, published systematic reviews for their analysis. They've done their own this time. And they say, we have found sufficient evidence supporting a causal relationship of red meat intake with heart attacks, with breast cancer, and the two types of stroke, hemorrhagic stroke and ischemic stroke. And they added these outcomes to the previously found relationships with diabetes mellitus and colon cancer. And importantly, they've changed the way that they are calculating what is the optimal amount of a food to eat. And they decided, without providing any evidence, that actually the optimal intake for red meat, the theoretical minimum risk exposure level, should be 0 grams, so no eating of red meat, rather than the previous value of 22.5 grams a day. Now, if you're going to do your own systematic reviews and meta-analysis, and if you're reporting on global health estimates, there are two protocols that all of the top medical journals have agreed that you must report your systematic reviews and the conduct of your global health estimates in. So for the global health estimates, the gather statement is relevant, and for the meta-analysis and systematic reviews, the PRISMA 2009 or 2020 statement pertains. Both of these statements require full disclosure of how you did your analysis, what studies you included, what studies you did not include, what are the residual elements of bias, and how certain are you of your evidence. Did Global Burden of Disease 2019 analysis produce that information? They did not. All we're told concerning red meat revised relative risk estimates and the reduction of the red meat TM or EL to 0 grams a day is that 760 sources were used in the estimates of dietary intakes, and 92 sources were used in the estimates of the relative risks and the TM or EL of red meat. Looking at the new outcomes where the global burden of disease says there's a relationship between red meat intake and adverse outcomes. The Global Burden of Disease 2019 analysis says that at 50 grams of red meat intake, there is almost a 10% increase in the risk of colorectal cancer. But as I've previously shown, the analysis that was reported by a very comprehensive review from the World Cancer Research Fund Continuous Update Project in 2018, they actually showed that at 50 grams of red meat, there was no increase in risk of colorectal cancer. Likewise, contrast the relationship for heart attacks or myocardial infarction. At 10% increase in risk, so a relative risk of 1.1 is equivalent to a 10% increase in risk for 50 grams of red meat intake. Whereas a review published in Critical Review Food Science in 2019 showed, if anything, there was protection from myocardial infarction at such intakes of red meat. For hemorrhagic stroke, this is a bleeding or a stroke that occurs due to a bleed into the brain. This is usually a very damaging stroke and commonly fatal. At 50 grams of red meat, Global Burden of Disease 2019 estimates indicates that there's a more than 20% increase in risk of hemorrhagic stroke. Whereas on the right-hand side of the slide, the 11 studies that have been peer-reviewed cohort studies of the relative risk of hemorrhagic stroke by levels of red meat intake are shown. And you can see, in actual fact, at 50 grams of red meat, there is no increase in risk shown by any of these studies. In fact, for any intake of red meat, there is no increase in risk of hemorrhagic stroke. In particular, look at the two largest studies to the right, the EPIC study, European Prospective Investigation into Cancer and Nutrition study, and the UK Biobank study. These are the largest studies. They have the smallest 95% confidence intervals, and it's an absolutely flat relationship. There is no relationship between red meat consumption and hemorrhagic stroke. The Global Burden of Disease says that from the first mouthful of red meat, there is an increased risk of mortality or of death. So starting at even 5 grams a day, there's a statistically significant increase in risk of dying. Contrast that with the analysis that was done by the PURE study, which is an actual real study from 21 countries worldwide, high income, intermediate income, low income countries. If anything, there is a protection provided by unprocessed red meat. Which would you believe? Which is correct, the modeled data or the real data? Now, global burden of disease studies are very, very impactful. They're published every 2 years in The Lancet for the past 30 years. They are extensively quoted and influence policy, so by such bodies as the Food and Agricultural Organization of the United Nations, the World Health Organization, the European Commission, the Farm to Fork Strategy for a fair, healthy and environmentally friendly food system, the National Food Strategy, and in fact the Eat Lancet used the 2017 data from the Global Burden of Disease collaborators. They are so influential that the authors or leaders of the Global Burden of Disease study actually self-described their studies as the de facto source for global health accounting. Because of our concern that the 2019 analysis would be equally impactful and influential as previous reports from the Global Burden of Disease collaborators, and because of this major difference in estimates of the dangers of red meat consumption, we wrote a letter to the Lancet querying these estimates. The title of our letter, Global Burden of Disease 2019 Estimates of Deaths Attributable to Unprocessed Red Meat Intake Increased 36-fold over previous estimates. Are these estimates reliable? This was written by 6 professors from 6 different universities from Ireland, the UK, Australia and Belgium. The key questions that we asked were, where are the peer-reviewed publications of the updated or new systematic reviews that underpin the Global Burden of Disease 2019 analysis? Where are those publications that address the PRISMA statement and the Gather statement checklists, that justify the updated dose response curves showing a relative risk between red meat consumption and cancer and cardiovascular endpoints, that show that we should reduce the recommendations for red meat intake from 22.5 grams per day to 0. We also asked them, have the additional deaths and DALYs from iron deficiency anemia, sarcopenia, or fragility in the elderly, child and maternal malnutrition that would result from imposition of a red meat TMREL of 0 been included in their estimates? We said that all global health estimates used in decision making needed to be rigorously and transparently evidence-based, and that was particularly important for global burden of disease estimates given their considerable influence. And we said that until the updated reviews and meta-analyses were published, it would be highly inappropriate and impudent for the Global Burden of Disease 2019 estimates to be used in any national or international policy documents, nor in any regulatory nor legislative decisions. We submitted this letter in May of 2021, and after 9 months of protracted negotiations, in fact, this letter is shortly to be published in The Lancet. The Global Burden of Disease 2019 collaborators have actually declined to respond to our questions. And even more disappointingly, they have declined to put into the public any peer-reviewed publications of their updated or systematic reviews. So we are not going to get the evidence that underlies these estimates, which makes it really important that these estimates are not used in any decision making of importance. The key take-home messages from my talk, which I'd be very happy to talk or to discuss with you in the panel session later on today. Animal source foods are nutrient-rich foods. The relationship between red meat and disease burden is U-shaped. Absolutely insufficient red meat consumption is associated with substantial increases in childhood stunting and impaired cognition, anemia, osteoporosis, and sarcopenia. There is low certainty evidence linking very excessive red meat consumption to very small increases in colon cancer and cardiovascular events. So certainly excessive red meat consumption, more than 100 grams per day, possibly more than 50 grams per day, is not recommended. Milk and dairy intake, certainly up to 3 portions a day, protects against both nutritional deficiencies and also cancer and cardiovascular events. If we try and replace fresh meat and dairy with additive-rich, calorie-rich, ultra-processed plant-based foods, that will very likely result in harmful effects on human health. And women, children, and the elderly, and those of low income will be particularly adversely impacted. Lastly, you as nutritionists should be very cautious in accepting global health estimates that are not rigorously and transparently evidence-based, and particularly if they ignore the protections against nutritional deficiencies afforded by animal source foods, by dairy, meat, fish and eggs. Thank you for your attention, and I look forward to our discussions later on in the day.